Hi, class. Dr. Lindner, welcome back. Let's take a look. We have in a previous video talked about the cervical plexus. We spoke about the brachial plexus. And in the introduction of the brachial plexus, what I was showing was that we know that the brachial plexus originates from C5 to T1 nerve roots. And then they branch and they go down the shoulder, down the arm. But near the cervical nerve roots, we can see the scalene sisters, right? We could see over here the scalenus anticus, and then over here we can see the scalenus medius, and then way back here we can see the scalenus posticus, or scalenus anterior, medius, and posterior. And you can see that the brachial plexus and the subclavian artery, these two structures get sandwiched between the scalene muscles. Okay, so if there is hypertonicity or spasms or tight and taut muscle fibers here, they can squeeze and compress what's called the neurovascular bundle. In the word neurovascular is neuro and vascular. These are the two parts that are being compressed. The neural part is the brachial plexus, and the vascular part is the subclavian artery. So the subclavian artery is subclavian, under the clavicle. It goes under the clavicle. And then it changes its name into the axillary artery, and then it changes its name again as it goes down the arm into the brachial artery. And then it changes in the forearm to the radial and ulnar artery, but brings blood all the way down into the fingers. Okay? So understand that when we talk about the thoracic outlet or thoracic outlet syndrome, one of the triggers of that is when the scalenes are in spasm. This can happen from texting neck, right? From people who text a lot and their head goes forward. This can happen from a whiplash where the cervical muscles become in spasm. This can happen in swimmers from rotating the neck, and the scalenes are accessory muscles of respiration. Anything that can irritate these muscles can then irritate this neurovascular bundle or the brachial plexus and the subclavian artery. But it happens to compress the lower end of the brachial plexus, which is C8 and T1. And this is important because when people get thoracic outlet syndrome, they end up experiencing symptoms that affect the C8 and the T1 dermatome. And dermatomes are a neurological mapping of the skin that are controlled by nerve roots in the neck or nerve roots in the lower back, if we're talking about the lower extremity. So the C8 dermatome happens to control half of the ring finger and the pinky and the medial aspect of your forearm to about mid-forearm, but on the ulnar side. And then T1 is the inside of the elbow. So if someone has thoracic outlet syndrome, their pinky and half of their ring finger goes numb, and the inner part of their forearm, the medial part of their forearm, goes numb. That's the C8 and D1 dermatome. So Thoracic outlet syndrome is the lower end of the brachial plexus, which is C8, and the T1 nerve root, and or that subclavian artery, can get compressed by the scalene muscles, which I just showed you in that picture, and or the pec minor. If we go back here, here is the pec minor muscle. So you can see it goes from the upper ribs right to the coracoid process. So there's your pec minor, and you can see the brachial plexus goes right underneath that. So people, women who are heavily busted, people with very strong chest muscles or pec muscles, people who are on the computer all day or that drive all day or are texting all day, anything that rounds the shoulders or bringing the shoulders forward, that can create another form of thoracic outlet syndrome. So one of them could be caused by the scalenes, and the other can be caused by pec minor. The symptoms will be exactly the same: numbness and tingling to that C8 and T1 dermatome, whether it's the scalenes doing the compressing or whether it's the pec minor doing the compressing, right? It's just what's being compressed is the same. What's doing the compressing is different. So the TOS, thoracic outlet syndrome, can be caused by the scalenes or the pec minor. So then how do we differentiate which structure is causing their symptoms? Well, I will show you two different tests. One's called Adson's test, and the other is called Wright's test. I'll show you these two tests and how they're performed. But the positive findings are going to be numbness and tingling down the medial aspect of the forearm and half of the fourth digit and all of the fifth digit. That is the C8 T1 dermatome. Okay. And if it's the subclavian artery that's being compressed, then you're going to have a diminished radial pulse. You'll have a diminished radial pulse and your fingers will feel cold. So right here, this individual is doing what's called Adson's test. And the way the test is done is, you can see he's taking the pulse here and he's feeling the radial pulse. And what he's doing is he's turning his head in the same direction as the arm to activate those scalenes. And then the next step, besides turning it, they would say, open your mouth and take a deep breath from your mouth. So that when you breathe in from your mouth, that's another way of stressing the scalenes. So turning the head, opening the mouth, inhaling and holding the breath for a second, that activates the scalenes. And if the pulse diminishes or there's numbness here to the pinky and to half of the ring finger, that's a positive Adson's test, indicating the scalenes are involved. If there's numbness and tingling, then it's the C8T1, it's the neural part. And if it's diminished pulse, it's the vascular part, it's the subclavian artery that's being compressed. If they think it's not the scalenes, so let's say that was negative, and the scalenes are good, there's no problem, then we think maybe it's the pecs. So what we would do is take the pulse again, feel that pulse, and now we're raising the arm above their head. Because when you raise the arm above the head, look what you're doing. You're trapping it under that coracoid process. And if that pec minor is really tight or in spasm, it's going to jab and squeeze and compress the neurovascular bundle. So if the pulse diminishes, then it's thoracic outlet syndrome that's caused by the pecs, whether it's diminished pulse or numbness and tingling down here to the pinky and half of that ring finger. So that's the Wright's test, right? They're hyperabducting. Just remember the Wright brothers made the airplane. So if you bring your arm out to the side, like you're an airplane with the wings, you can also consider it the hyperabduction test because you're hyperabducting the arm. And then what you're doing is you're just feeling for the pulse or looking to see if they have numbness or tingling down the ulnar aspect, down to the pinky, and half of that ring finger. And that would tell you that the culprit here is the pec minor muscle, a tight pec minor that's compressing that neurovascular bundle. The neural part being C8 and T1, or the vascular part being the subclavian artery. Okay, I'll take a pause here. When we come back, we'll get into a few other clinical conditions of the upper extremity.